All right, you there, doctor?
Yep.
Excellent, okay. Welcome back to Game Night powered by Oak Orthopedics, and welcome to the Oak Sports Medicine Report. Today we are joined by our old friend, Dr. Kermit Muhammad. Dr. Muhammad, thanks for taking out the time tonight.
Thanks for having me.
Excellent. We're going to talk about hand injuries, something you're pretty well versed in as a doctor, and you know, football players, they are no strangers to getting their hands injured and dinged up, anywhere from your typical jammed finger all the way up to some pretty severe injuries. But let's start with the simple. You know, I know one of the easiest things to do whenever I was playing sports was jam my finger. So, you know, let's talk a little bit about that. What exactly is a jammed finger, and how does that present to you as a doctor?
Well, a jammed finger can mean a lot of different things, and you know, ultimately you're talking about kind of a direct load, where the finger is hit directly by the ball, or maybe put directly into a person's jersey or pads or to the ground. But there's kind of a force that directs the finger, and so it can lead to something as simple as a sprain. It can dislocate the finger. I mean, there's so many injuries that can happen with it, and fractures. So, you know, when people use that term jammed finger, it really means a lot of different things. But ultimately, usually if the ball hits it, you know, you kind of consider that a jammed finger.
And you know, are there any different types of treatments you can do? Do you just let it heal on its own, or do you splint it up, or does it really depend on what the actual injury is to the action of the jammed finger?
Well, it definitely depends. I mean, you can kind of go to the extremes. So, you know, if you get a jammed finger and actually the finger looks deformed, you know, I mean, maybe it's dislocated, maybe it's fractured. You'll see players and trainers at various times kind of pulling on fingers to straighten them back up. You know, it's kind of important at those times to really get an assessment as to what's going on, you know, whether it is a fracture or not. Most of the time when that happens, you know, they might get it taped up and go out and play. But it's important not to wait till the end of the season to get something like that checked out, because I do see that very often where, you know, people kind of tend to wait for things and then check it out later. And sometimes it's too late.
You know, when we talk about too late, are we talking about too late, we're just going to need to cut it off? I'm joking a little bit. No. But
No.
we're talking actually more too late, like there should have been rehab going on, and there'd be loss of strength, like permanent loss of strength, for something as simple as that you thought was, I'm doing the air quote on this, as a jammed finger.
Right. Well, I mean, ultimately, you know, the expectation is when you use that term jammed finger, you expect, you know, in a few weeks for things to get better, you know, for your motion to return, for the strength to return. And if it's something more serious, you know, there's a fracture, some kind of injury to the joint, or maybe the ligament is torn, then ultimately, if it's not adequately treated, it's just not going to recover. And then, you know, when you're treating a chronic problem, the outcomes and the results are just not as good as getting something that's a fresh injury that can be treated.
And that's really where the danger does happen, and it all comes down to a proper diagnosis when the injury actually happens, right? Is it X-rays or a CT scan or something like that you would use, or is something much more simple than that?
Well, usually an X-ray is kind of the baseline, and you just kind of get a general picture of what's going on. That's usually enough. You don't always have to go up to you know, the CTs and the MRIs. You know, sometimes you need a more detailed analysis, and those can be indicated. But usually, just getting an X-ray, getting an exam by you know, a hand surgeon, orthopedic surgeon, you know, that's where you start.
All right, well, we're going to send this one out to break, doctor, and we're going to talk about treatment on these injuries when we come back here on Game Night, powered by Oak Orthopedics. Welcome back to Game Night, powered by Oak Orthopedics and the Oak Sports Medicine Report, and we are joined by Dr. Kermit Muhammad of Oak Orthopedics. And Dr. Muhammad, before the break, we were talking about some different hand injuries you can get while playing football. And let's talk a little bit about some of the treatment that you would go through this. I'm assuming it's a lot of rest, but what I'm more interested in is like the rehab afterwards to try to make sure that strength doesn't get lost in the fingers and in the hands.
Well, it's important to recognize, I mean, there's definitely a gradient scale of these injuries. So some of them generally do not need significant rehab. You know, if there's a small, what we call hairline or avulsion fracture, usually buddy taping the fingers together and gradual return to normal use is what's needed. if you have a fracture or a sprain or a ligament tear that involves the joint, then you may be talking about some formal occupational therapy or hand therapy, something to make sure that the full motion is restored. I mean, you can kind of think of like when you watch these TV shows like the NFL shows. If you see some of the announcers and you look at their hands, especially the former football players, you see lots of deformities that are just like still there. And so that's a result sometimes of either lack of treatment or lack of rehab.
Yeah, those gnarled hands get pretty nasty. You always know when you're shaking the hand of an old tight end or offensive lineman because the grip feels real funny on their hands when you shake their hands.
That's right.
Do you find, doctor, especially as you progress as an athlete into high school and college, that people tend to take these hand injuries they take their hand bending injuries like sort of for granted, in the sense that oh yeah, it is maybe just a jammed finger, I should be able to just play through this, when in fact that there's some underlying problem that actually is more serious.
Well, yeah. I mean, I think there's such a profit motive to overlook some of these things when it can be overlooked in some cases. Unfortunately, I mean, you have scholarship athletes that, have to perform. You have players that are vying for scholarships. And then when you get to the professional levels, you're really talking about people vying for, huge contracts. And you have a lot of other interests that are there, which may kind of push beyond the physical limits of what's possible. So it's because of these other factors. It's not really purely a medical thing. These other considerations that cause people to kind of overlook things that maybe should be addressed.
And really, that's when you come down to you have the issues that are more long lasting. Where I mean, I'm assuming you obviously just have the gnarled hands, but I'm assuming there can be arthritic problems later on from these being untreated.
That's true. That kind of depends on the injury, and but I definitely see that without question. And many times, in older adults, will find injuries such as an old, what we call a scaphoid non-union. It's a little bone in the wrist, and oftentimes it'll be a person that has arthritis later in life, and I'll ask them, did they have any injury? And they'll say, well, no, but in high school and football or whatever sport they were playing, I did have a wrist sprain or something like that. And so that to me means that a lot of these things are missed at a younger age, and it does affect people when they get older.
Well, Dr. Muhammad, thanks for taking up time tonight. The hand injuries always fascinate me because I think I am in that majority that doesn't takes it for granted a little bit. I know I played through a lot of jammed fingers when I was growing up.
Definitely.
All right, thanks again, Dr. Muhammad.
All right, thank you.
All right, this has been the Oak Sports Medicine Report, and coming up next, we've got the Dr. Rafi's Coaches interviews with Mason Schweitzer coming up next here on Game Night, powered by Oak Orthopedics. All right, Doctor, thanks so much. I appreciate you taking the time tonight.
Okay, no problem. Thank you.
Yep. Have a good one.
All right, you too. Bye.